Welcome to the sixth section of Chapter 17, Patient Assessment, entitled Level of Consciousness. As always, this is Keith Whitmire with Wayne County EMS. We're going to get started talking about the AVPU scale. AVPU stands for Alert, Verbally Responsive, Painfully Responsive, or Unresponsive. Everybody who's listening to this lecture, although as boring as I may be, you are generally alert. V stands for verbally responsive, or responds to verbal stimuli. When you go and you shout at your patient, "Hello, can you hear me?" and whichever choice phrase you choose to use, and your patient responds with either a grunt, audible sound, or verbally responds, then they are V on the AVPU scale. If that patient does not respond, you will go to the next leg on this scale, which is painful stimuli. This can be done by pinching the shoulder or doing a sternal rub. If your patient does not respond to painful stimuli, then they are classified as unresponsive. Patient looks as if they're sleeping. Gently rub the shoulder and ask, "Are you okay? Can you hear me?" Unresponsiveness may indicate a life-threatening condition. If the patient does not answer, family or bystander may be able to supply information. You may ask, "Can you tell me what happened?" When determining the patient's level of responsiveness, we determine if the patient's awake and responds appropriately to questions. We evaluate the patient's orientation. This is done times 4. So we evaluate their orientation towards the person. If the patient can tell you their name, place, if the patient is able to tell you where they're at, time, the patient can tell you the day, date, or time. And this may be relative. Some elderly patients may lose tracks of the day of the week or the day of the month, and that's not abnormal. However, if they think it's 1976, well, then there is an issue. In events, the patient can tell you what happened. If the patient is oriented to person, place, time, and event, they are said to be alert and oriented, or conscious, alert, and oriented times 4. If the patient is awake but cannot answer those questions correctly, the patient is said to be confused or disoriented. For example, your patient is awake and knows their name and where they're at, but does not know the day or relatively day or time. They're said to be alert and oriented times 2. If the patient is not awake but responds appropriately when spoken to, they are said to respond to verbal stimuli. For example, the patient will respond correctly and requests such as "squeeze my fingers." If the patient is not awake but responds to painful stimuli, such as a pinch on the skin on the back of the hand or earlobe, they are said to respond to painful stimuli. The patient is unresponsive if they do not respond to verbal or painful stimuli. An alert infant or young child, younger than 3 years of age, smiles, orients to sound, follows objects with their eyes, and interacts with those around them. As the infant or young child's mental status decreases, the following changes may be observed in order of decreasing mental status. The child may cry, but can be comforted. The child may show inappropriate, persistent crying. The child may become irritable, agitated, or restless, and the child may have no response. As you continue your assessment, note any changes in the patient's mental status. The brain requires a constant supply of oxygen and sugar. Changes in the patient's level of responsiveness may result from a decreased supply of oxygen or sugar. These changes may also come from the use of alcohol or drugs, brain swelling due to an injury or other causes. In a trauma patient, agitated and combativeness may be due to a decreased supply of oxygen. It's important to document and report which realms of orientation the patient is disoriented to. If an advanced life support provider arrives on the scene, be sure to tell them about the changes in the patient's mental status. Otherwise, relay this information to the staff person who takes the report from you at the local receiving facility. In the pre-hospital care report, document the patient's response to a specific stimuli and any changes in mental status. For example, the patient opened their eyes on command. The patient moaned in response to a pinch on the wrist. The patient knows the patient's name but does not know the date, where they're at, or what happened. For trauma patients or unresponsive patients with an unknown nature of illness, it'll be imperative that you take spinal precautions. Spinal precautions means that you stabilize the head, neck, and back in a neutral inline position. The stabilization is done to minimize movement that could cause an injury to the spinal cord. The techniques used to minimize movement of the head and neck is called inline stabilization. The term inline refers to keeping the head and neck anatomically in line with the body. Inline stabilization is first performed by using your hands. This is called manual stabilization. If the patient is awake and you suspect trauma to the head, neck, or back, face the patient so that he does not have to turn their head to see you. Excuse me. Instruct the patient not to move their head or neck. Position your hands on both sides of the patient's head and spread your fingers apart. Place the patient's head in a neutral position, eyes facing forward and level, and in line with the body. If the patient complains of pain, you meet resistance when moving the head and neck into a neutral position, stop and stabilize the patient's head and neck in the position just before resistance was met. Once begun, manual stabilization of the patient's head and neck must be continued without interruption until the patient's properly secured to the backboard with the head and neck stabilized. Excuse me, I apologize. Emergency care that may be needed to manage the patient's airway during the primary survey include spinal stabilization as needed from trauma, head tilt chin lift or jaw thrust, suctioning, repositioning, removal of foreign body, insertion of oral airways or nasal airways. And this concludes the level of consciousness section for patient assessment.